Hi guys, hope you're well. We're doing a course on the weekend and we were talking about signposting, and I think it's a really important thing to do in medical exam role plays, whether it's things like CSA, RCA, plab 2 and many others. But why do we do a signpost? Often we think about signposting for things like red flags or lifestyle questions in order to give a sign or a heads up to the person that we're talking to, i.e. the role player. And yes, it's important to do that, but a signpost actually is really important for all three people involved in that exam or assessment: the patient or the role player, the assessor, and thirdly for you yourself as the one who's running the consultation. So let me explain. Say for example you're doing red flags, you'll give a signpost, Mr. X. When it comes to indigestion, there are a couple of medical questions that we need to ask. I'm just going to run through a couple. Or if it's a lifestyle type of signpost, Mr. X, when it comes to headaches, there are a few things in our lifestyle that can trigger these. I'm going to run through a few things about you and your lifestyle. Either way, the signpost is for all three people involved. Number one, of course, is for the patient or the role player. They've come with indigestion or a headache. They're not sure why certain questions need to come, so you need to signpost the need for these questions. But secondly, it's important for an assessor. Say for example you're being marked on red flags, or you're being marked on your ability to do a psychosocial history. By prepping the assessor, it makes it easier for them. By you saying, Mr. X, I'm just going to run through a couple of yes/no medical questions just to make sure everything's okay, they're kind of getting ready to think about red flags and ticking you off for an effective, safe red flag history. So it's important for the assessor, but also really importantly, it's important to signpost for your own mind as well. Say for example, you just think, I'm going to ask red flags, and you start asking a whole lot of red flags for say back pain or headache. You're probably going to forget a few if you just jump straight into it. However, if you've given yourself or your brain a signpost first, you're more likely to get them all in one go, increasing your efficiency and making it sound like a more structured consultation. So when you say, Mr. X, I'm just going to run through a couple of medical questions just to make sure everything's okay with your headache, you're prepping your own brain to get those headache red flags in position and ready to fire. So signposting, of course, is super important when it comes to role play based, consultation based assessments. But don't think you're just signposting for the patient or the role player. You're signposting for three people. Number one, the role player or patient. Number two, the assessor who's listening or watching. And number three, for your own brain as well. We do so much more communication, consultation, skills-based training and teaching for multiple exams, whether it's plab 2, RCA, CSA, and many others, on our live courses, on our online courses, and on our audiobook courses. And for watching this video, you can get 10% off any of those on the website, aroramedicaleducation.co.uk. I'm Dr. Amin Arora, and I train people for these exams day in, day out by using the coupon Arora Video 10, ARORAVIDEO10. Have a look at the website, aroramedicaleducation.co.uk. If you like this video, please subscribe, please do comment, and please do share. Hopefully you can watch many more of these videos to come. You know the hashtag, can pass, will pass. Hashtag I went with Arora, role player, assessor, and your own brain. 3 reasons why signposting is super important. Have a good day.